Welcome back to the channel. It's been a week and today we introduce NCLEX Trap Series Part 6, the only if education trap. If you do not know what's going on here, this is brought to you by VPNG NCLEX Academy. We decided to bring out frequently tested areas on NCLEX and we're going to break them down on this channel. So feel free to subscribe. You can also join our NCLEX Academy. Look out for the link in the description box or in our bio. Let's get into the program. The only if education trap is extremely common on NCLEX, especially in client teaching questions. If you're enrolled in our academy, you know we already discussed something about how the first time you teach a client or a patient about how to care for themselves and their condition, it has to be done by the registered nurse. So it's the sole responsibility of the registered nurse. And NCLEX tries to test your ability to teach the client and figure out when there is a misconception by the clients, because we're trying to be safe nurses here. So the core idea is that NCLEX hides the correct answer behind a conditional safety statement. So something that the patient should do only under certain circumstances. And students usually choose answers that sound generally healthy or educational, but NCLEX prefers precise safety rules. Example patterns, you see phrases like, take this medication with food only if stomach upset occurs. Use this medication only if your blood pressure is above a certain value. Stop the medication only if you experience these symptoms. Use this treatment only if symptoms worsen. And students tend to choose statements that sound universally correct, but NCLEX prefers statements that show that the patient understands when something should or should not happen. And why is this a trap? Because many answer choices sound good. I will take my medication every day. I will drink more water. I will avoid stress. These are vague wellness behaviors. But the correct NCLEX teaching answers often include conditions, thresholds, safety triggers. So the exam is asking, does the patient understand when an action becomes necessary or dangerous? And this tests your clinical judgment. You need to know when to hold medications, when to seek care, when to continue treatment, when something becomes dangerous. I would give an example with this question we derived from UWorld. The key thing is that you have to understand when a patient understands what's expected of their management, okay, and be able to point out odd statements that they make in the scenario. So let's look at this. The nurse is teaching a client who had a pulmonary embolism and has a new prescription for warfarin. Which of the following statements by the client would require follow-up? Select all that applies. Here we have 5 statements. 1, I can expect to take this medication for 3 to 6 months. 2, I should brush my teeth using a soft bristled toothbrush. 3, I should take baby aspirin if I experience mild chest pain. 4, I can place small rugs on hard floors to provide cushioning if I fall. And 5, I will wear emergency medical identification while taking this medication. 2 answers are correct here, which is I should take my aspirin if I experience mild chest pain, and I can place small rugs on hard floors to provide cushioning if I fall. And this is because warfarin teaching is full of conditional safety rules. So students often choose answers that sound safe, but NCLEX is testing when something should or should not happen. I should take the baby aspirin if I experience mild chest pain. Why does this fail? Because patients on warfarin should not add aspirin unless specifically instructed by the provider, because it increases bleeding risk. So the correct teaching would sound like, I should take aspirin only if my healthcare provider instructs me to. And this demonstrates the only if principle perfectly. So If this makes sense to you, if you'd like to hear more hidden NCLEX traps, subscribe to this channel and keep up with our NCLEX trap programs. We're trying to publish them as often as we can, just to help as many candidates as possible. If you need NCLEX tutors, if you want to be part of our NCLEX Academy, where we break down every system, every topic by patterns, by traps from question banks, contact us via email. Our email address is contactus@vpngglobal.com or vpngnclexacademy@gmail.com. See you in the next video.